Welcome to the Q&A follow-up to our webinar this past Tuesday on long-term care for Christian Scientists. Thank you for joining us today. I'm John Mitchell, and I serve as Executive Director and CEO of Ardenwood here in San Francisco. And by the way, our next event is our annual meeting, which will be presented online again this year on Sunday, May 1st at 2 p.m. Pacific. Please keep your eye out for an invitation via email and regular mail in order to register for this annual event. Warren Huff, Executive Director Emeritus of Cedars Camps in Missouri, will be our inspirational speaker. And the title of his talk is Bible-Based Rules of Healing to Apply and Prove Today. You won't want to miss it. Now, before we begin, I'd like to share a few thoughts with you about today's topic, long-term care for Christian Scientists. Because Christian Scientists are wiser than serpents, they are matter-of-factly prepared for moments that Mrs. Eddy refers to as inspiring discontent. I love that, inspiring discontent. That's a marginal heading from Science and Health with Key to the Scriptures. Christian Scientists make informed personal decisions, and just as important, they don't want to be a burden to their families, not physically, not emotionally, and not financially. People come to Ardenwood because they expect to be healed. Healing is our primary focus. Financing care through Medicare and supplemental insurance helps cover the cost of these shorter-term needs, while the patient is actively, metaphysically addressing the specific claims about their well-being and having this prepared ahead of time. One of the most important first steps to complete is an advanced healthcare directive. You'll hear that throughout our presentations before and after this. It's an AHCD, and let your family know what's on it and where it is located. I can't emphasize enough how important this is in today's world. You can find an example of one on our website, ardenwood.org. On our website, click on About at the top of our homepage and then on Healthcare. Scroll to the bottom of the page to find the link to the AHCD. And finally, the content shared today is only informational and is not intended to be legal advice. A replay of this presentation will be available on our website in a day or so. And now, let me reintroduce today's presenters, Jim Maher, Katie Burris, and Lesleah Frisco. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's been helping individuals and companies navigate Medicare since 1989. And he frequently speaks to law firms, CPAs, medical groups, school districts, Rotary clubs, as well as large and small companies. And as we've said before, he's spoken to over 13, 14, 1,500 Christian Scientists, Jim. My goodness, it's been amazing. Jim also is a certified long-term care insurance strategist. He specializes in helping human resource professionals with their Medicare questions regarding current employees on how Medicare integrates with retirees and COBRA. Jim and his wife of 36 years, Teddy, live in Lincoln, California, just above Sacramento. Katie Burris is a Medicare specialist and a certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew & Maher Insurance Services and has been in the business for 17 years. She is licensed for life insurance, long-term care, and Medicare in several states. Katie's married to her high school sweetheart, Brian, and they are busy with their 2 daughters and 3 dogs. Lesleah Frisco is Ardenwood's Director of Christian Science Nurses Training. Leslie graduated from the Mother Church's Christian Science Nurses Training Program and has been a journalistic Christian Science nurse since the early 1980s. One of Leslie's previous responsibilities was to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit in paying their costs. In this regard, she is an unsung hero for her diligence and competence in wading through the intricacies of Medicare. And there are many.
Amazing.
If you have any questions, please click on the Q&A icon at the bottom of your screen, and another screen will appear where you can type in a question. Press submit and it will arrive here. You're the only ones seeing your questions. Joining me now are Jim, Katie, and Leslie. Let's begin with questions that we weren't able to get to on Tuesday. So we've got a lot to go here, folks. Thank you for being with us today. So first up, we've got a few of these, and some will be repeats because we've gotten them, but we'll get underway. Does a long-term care plan require a medical exam first?
Normally not. No. Some of the carriers were used, they will do simply a phone call, personal history interview. And with most Christian Scientists that have unbelievable health, normally that satisfies the insurance company, quite honestly.
If there is an exam or anything, you wouldn't have to have a doctor. A paramed might be scheduled, but we would talk to you beforehand and find out if that's something that you would be comfortable with. But most of the time, it's just a telephone interview.
Right.
Because a lot of folks, this particular individual says they are 77 years of age and they never go to doctors. And so that from your, in large part, most Christian Scientists haven't been to a doctor in many, many years or ever.
Yeah, the insurance industry doesn't get that, right? They're like, well, how come they're not going to the doctor like everybody else 10, 20 times a year? They don't understand that. You're too healthy, right? They go, that's a blessing.
We've talked with insurance companies. So there are some insurance companies, while they might have a great long-term care insurance plan, they say you have to have seen a doctor. And we said, nope, next. And we find, so we're trying purposely to work with companies that are the most Christian Science friendly.
Right.
Great. That's wonderful. What is the typical premium for a life insurance policy with long-term care benefits? I know you get that question a lot.
So it really is kind of all over the board as far as what you can afford. And then some of the insurance companies have minimums as far as you have to put in a dollar amount so that the minimum monthly benefit is like $2,500 a month in benefit. So it's very individualized. And so that's why a lot of times we recommend people give us a call. We can kind of talk through the options with you and see if that's feasible.
It's kind of like talking to a car dealership and say, listen, I want to buy a car. How much does a car cost? And you're going, well, it really depends, right? Are you looking at a Mercedes, a Honda, a Hyundai? Katie, you're right. We can try and customize it, but I wish I could just say, when I first started, it was pretty typical $100 a month, right? That was back in 1989. And that may be a week, I don't know, but it's really hard I always tell people it's very expensive, the care, right? They go, how much does it cost? I go, well, in San Francisco, it can be $14,000 a month. They go, no, for a policy. And I go, well,
it's a lot less than that.
It's a lot less than that. So,
right. I think not just Christian Scientists, but a lot of people just have no idea what things cost.
Yeah.
And we just that's why we want to be prepared and have a plan, right? Next up, I'm about to retire and I don't have long-term care insurance. Is it too late? I'm thinking that my monthly income after retirement will not have much extra money to put towards anything other than my monthly expenses. There's not an age put in here, but
so that age is really what is kind of that driving factor, so to speak, because like Jim says, you have the insurance world. And so what they do is they're looking at the population as a whole. So some of the insurance companies say, 70 is our cutoff. Some of them, the cutoff is not till 80. So it's kind of all over the board.
And then we always look at everyone's, you talk about individuals. We like to send out a little questionnaire. We find out a little more about that person, not a lot, a little 2-page questionnaire, and to make sure it's appropriate. Because a lot of times, John, it may not be appropriate for someone if they don't have the means for that. They're going to have to do some other kind of planning. So we always want to make sure it's affordable and it fits every individual, and everybody's so different out there.
Mm-hmm.
Great. This is for you, Leslie. Please clarify if Christian Science facilities can or will take long-term care insurance. Thanks.
Well, good question. Often, and Jim, you can correct me on this, is it always or is it often that they require it to be a licensed facility?
Most traditional plans are reimbursement plans, right? Require you to be a licensed facility.
Unless they have that Christian Science facility rider.
That's correct.
Right. And
Or
speaking
wording
about,
right now.
yeah, because the riders, if you happen to have that wording written in Christian Science nursing facility or sanatorium, whether it is a SCS, serving Christian Science policy, or whether it is any kind of long-term care or Medicare policy, Medigap policy, don't let go of that if you've got the wording Christian Science nursing in there, because you can't get those policies now that are worded in that way. And so those are golden. Like SCS, they will pay you now if you have a plan, but you cannot get a new plan with them.
And if you can't find your policy, Leslie, we tell everybody, make sure, call the insurance company, get a replacement, and make sure that verbiage is in there, right? You definitely want to, I've seen for years where a sales agent will tell somebody, hey, this is what's covered, and it may not be in the contract. So you want to get a copy of the policy to make sure that verbiage is in there. And most companies are absolutely willing to do that. So if you can't find it or misplace it, you're unsure, call them and have one sent out.
And I'm not sure I really answered that person's question, because of all the Christian Science nursing facilities that I'm aware of in the country, I only know of 2 that are required to be licensed by their state. Ardenwood is not one of them. So,
Well, they aren't even in California.
Exactly.
So,
there aren't any in California that are licensed.
So Jim, what we could do if someone, let's just say Mr. Smith, Mrs. Smith, whatever, would go to you and say, I've been in dialogue with AYZ company, and can you help me navigate getting that wording into my policy, because the state that I live in, they aren't licensed. Is that possible? You could do something like that?
We would certainly review it for them, but most of the time, John, once that contract is issued, and if it doesn't have that verbiage in there and they were told that it's covered, they're going to revert back to what the actual policy, the contract says.
Right,
So,
but before the contract is signed, I guess I can't.
Sure.
You can't do something.
Yeah, absolutely. And we just don't see that out there anymore. I think it was it Mutual of Omaha, I think, used to have a Christian Science friendly rider on it.
Right.
And I don't believe they've had that for years. So if they have them, we're the first to say, hang on to that. You do not want to let that go.
And Jim,
There's a
I'm
big
wondering
insurance up in
if it
Maine
is-
too. I can't think. Yeah.
Okay.
if it is, if you could negotiate with them and try to explain that we are the facilities that are religious non-medical healthcare institutions, so RINKIs within Medicare, if that certification, which is actually higher than most licensed nursing homes would require, if that might satisfy their requirement.
Yeah, it really depends. They always revert back to like the terms and the Social Security definition of a licensed provider or licensed healthcare provider. And it can be pretty broad, really, in terms of like who can qualify you for the claim. So it can be a physician. We've seen, right?
chiropractor can be a lot of different
It can be a lot of different people. So unfortunately, the insurance companies, have their rules and regulations, and they don't often bend to that. And we try. We're saying, listen, they're a Medicare approved facility. So why you're accredited, right, John? It's just you're not licensed in the eyes of the insurance companies.
Right.
Exactly. So you can help people with that clarification.
Yeah, absolutely.
Yeah.
Perfect. Thank you. Distinguish what makes something long-term care versus traditional Medicare. Is it the length of the term at the facility? I rely on care at Christian Science. If I rely on care at a Christian Science facility, what is the need for this when it doesn't cover care at a Christian Science facility, which is kind of what we just talked about?
Who would you
It
like
gets
to
down to
answer
what the
that?
policy says.
So Medicare is basically the coverage for Christian Scientists within Medicare is hospitalization and skilled nursing facility, but it does require that the individual have a need that requires skilled care. Long-term care typically is more routine custodial type care. It's a different level of skill, and that is not covered by Medicare. Medicare covers a period of time up to really 90 days, up to 60 days of full coverage, additional 30 days of partial with a deductible. But beyond that, that's where a Medigap policy would come in handy if you still required skilled care. But if you did not require skilled care, Medicare is not going to work.
The other kind of last part of that, the tail end of that question, was about a long-term care policy that doesn't cover you in a Christian Science facility. The benefit to still have a type of policy like that, or to look at a policy like that, is if you don't live near a Christian Science facility, so that isn't realistically going to be part of your care, or if and when you want to have some of your care done at home and you want that practical side that we talked about on Tuesday, that kind of practical, errands and home services that need to be done.
Or if some Christian Science facilities may not be able to admit a long-term care case if they just don't have the room.
Correct.
So, yeah.
Great. Next up, I enjoyed the presentation. I do believe I have one of those HMO plans. This is more, get some Medicare questions here. I did sign up for the plan a few years ago and would like to get some supplemental plan that you were recommending. How do I go about changing my plan? Is that something you can help, or do I need to call Medicare?
So that's something we can help with. You are just barely in the last squeaking in underneath the time. That cutoff to drop a Medicare Advantage plan like that is March 31st. And then we could potentially look at, for April 1st, putting you onto a Medicare supplement plan. We would want to talk to you ASAP. We would want to get some information to get you some rates, and then get that application done, because you would have to answer their health questions. There is no exam or anything required to do that. They just ask the health questions.
And that's a week from today.
Yeah.
It's the 31st.
So John, you've had some interesting, we know HMOs aren't really Rinky friendly. And I think you told me before, it can take sometimes over a year to get paid, right? Or compensated.
Mm-hmm. Absolutely. It's not easy to get authorization. So often they don't, upon admission, they will not approve. You're out of network, and then if they deny it, then you're working on an appeal to get coverage. And there are some times that it does not cover. Legally, they are supposed to cover everything original Medicare does. Right. And original Medicare includes Rinky coverage, but it's still very difficult.
Yes. My spouse needed care in a hospital and a facility, and he was covered by his retiree plan. I have Medicare Parts A and B, but no other coverage. Is now the time that I can add a supplemental plan? Not sure if I have to wait until July 1st. I appreciate your guidance.
Normally, are you? I'm assuming they meant a group retiree health plan. I would think.
Mm-hmm. It sounds like for this.
So with that, right, you've got to have Medicare Part A and B. That's the primary coverage. And then the retiree plan is a secondary coverage, a secondary payer, right? That would pay. So if they have that, Leslie, they could come in to see you, or I should say at Ardenwood, because Medicare would be primary in that instance.
And then I know what they're asking as far as the spouse that doesn't have the group retiree plan, that just has A and B. You can, at this point, apply for a Medicare supplement plan. You would have to answer the health questions if it's been more than 6 months since you started Part B.
Great. Sorry, I muted myself for a second there. I'm sorry. Like, where's the mute button? There's a lot of these questions. Is there an age limit for application for long-term care insurance? In this case, I'm 86. Is it too late for any long-term care? Where are the thresholds? And you had mentioned a little bit of that on Tuesday.
So they used to go a little bit higher in age. I would say that the cutoff for most of them is age 80 now. Yeah. And that is just due to the pandemic issues that we've had over the last couple of years. That has kind of backed off insurance companies, and so they've lowered the ages.
Mm-hmm.
Can you state those ages at all, or?
About 80 is the cutoff for most of them.
There's a few companies that will go to 85. Usually 86 plus is, and we've had some of those calls yesterday too. That's usually where you need to really have another alternative, I should say, I guess, right? Mm-hmm. They're not going to insure normally somebody over age 80, 85.
And so that's where you might be able to work with someone with life insurance or something like that?
We could certainly try. Yeah, life insurance sometimes will go up to age 90. It just
Right.
and like Katie said, this COVID thing changed. All the insurance companies dropped their ages down, so they were worried about all the mortality and the costs they were going to incur. So a lot of them dropped. We're at 75 to 69 or 65. So unfortunately, that's what we have to deal with. And
Sure. So it's good to call you both. You said premiums are all over the board. How about our starting spot? Does it start at $100 a month, $1,000 a month, $5,000 a month? They're just trying to get a ballpark reading, if you will.
Right. So if I was going to the car lot and say I want to buy a car, would I be paying? It's really hard. We get asked that. The old time traditional policies, John, that aren't, we're not fans of them anymore. Then you could say the average there was, maybe $300 or $400 a month or $500 a month. The asset-based plans we're presenting with better options, they don't, it's more than that. But remember, you're going to pay into it, but you're going to get a benefit back, whether you. Right, Katie? I don't know how to say.
So most of them, you're going to either pay like a lump sum premium, or you're going to pay a premium over 5 or 10 years.
Right.
Most of the insurance companies want that as an annual. Some of them will do it as a monthly. I would say you're probably, if you do it over like a 10-year period, you're probably still looking at, like for someone in their mid 60s, maybe $6,000 a year.
Right.
Which would be don't hold me to that number, please.
Right. It's so hard because it's based on age. So the younger you are, like we have a lot of people turning 65 and we're saying, if you're going to do this long-term care plan, you should do it at 64 because the internal costs in the policy are less than if you're 65, or if you're going to be 66, you want to do it at 65. The longer you wait, the more expensive it gets. Mm-hmm. We can do younger. We don't do many. I've done some 40-year-olds and 45-year-olds that really have that vision and planning. Go, I want to get this. It's happened to my parents. I don't want it to happen to me. So then it's much more affordable.
And what we're seeing with a lot of individuals is they're going, I have maybe some extra money in savings, or I have a CD or something like that, or I have a very old life insurance policy, right, and I want to take that amount and just move it over to the insurance company either once or over 5 years, mm-hmm, and then not have to deal with the long-term care. That's right. So if someone is specifically asking like the cost, and they
so
want
to say,
it would be easiest to reach out to us, and we could really say, okay, is that realistic that you could get decent coverage for an amount if you have that in mind?
It would be like asking Leslie, how much does it cost to stay there if I have Medicare, and what's my cost going to be if I go? Right? It's really hard to give them.
Depends on how much care you need. So it's,
right?
It's the same thing.
Yeah, that's exactly. Yeah. So we don't want to misinform anybody, but we just want them to know their options, and it's different for everyone.
It's different in every state. Each state has some different plans available, or different ways the plans are established, and your age and whether you're male or female. So that's a really hard thing to kind of nail down an amount.
Great. Next up, can you name a few companies that have Christian Science friendly long-term care policies?
Well, we're big fans of Nationwide, and again, because it pays a cash benefit, right, an indemnity benefit, that I can use those monies wherever I want. Like I always say, I can pay my grandchildren to mow my lawn, my sister-in-law to go shopping for me. If I want to stay at Arden Wood, I can use those monies for whatever I want, right? There are no restrictions.
We wouldn't have to be a licensed facility for that to apply.
Right.
That's great.
That's exactly right. I can use those monies for whatever I want, and that would include staying at Arden Wood. Some of the life insurance policies work the same way too, where they have you get a portion of the death benefit in advance, and you can use those monies for whatever you want, right? There are no restrictions on where you can receive care once you've triggered the benefits.
Great. Leslie, you might be able to answer this. Which 2 states have licensed Christian Science facilities?
To my knowledge, it is Ohio and it is Missouri.
Missouri, yeah.
Okay. I didn't know that.
Ohio, Missouri.
Yeah.
Does Medicare cover skilled nursing in the home? Good question, one we get a lot.
Unfortunately, it does not. About 25 years ago, they did a little test, a beta test. I was working with a very active visiting Christian Science nurse service at the time, and it did not pan out. So we've not been included in that coverage with Medicare.
Next up, does the long-term care plan they are describing cover Christian Science nurses working in the home? Or do the care providers need to be licensed or otherwise certified other than Christian Science journal listing?
It
Maybe
sounds
both of you can answer that.
like what Jim was just talking about might apply.
Exactly.
There is, this might be a good place to put in a plug for the National Fund for Christian Science Nursing, because that will cover, if there's a financial need, it will cover any Christian Science nursing care being given by a Christian Science nurse, whether it's in the home or a private duty nurse, a visiting Christian Science nurse, or within a facility. Any level of care as well.
And what is that website again, Leslie?
Sorry, it's National Fund for Christian Science Nursing, and it's the initials nfcsn.org. It's administered through the Principal Foundation, but it has many funding sources. It's very easy to use. Usually get confirmation within a few days. It's very generous. Great. We're very grateful for it.
Very grateful indeed. What does Medicare Part B cost? I'm 88.
$170.10 a month. So that's the part.
That's very impressive, Jim.
It was $148.50 a month last year, and they had they gave you a raise in Social Security of just under 6%, and then they hit you with that premium from $148.50 to $170.10 a month, right? And that's normally coming out of your Social Security. When you activate Part B, they take that every month out of your Social Security check.
And if you don't have Medicare Part B and you're over 65, May 31st, next week, is the deadline to add. Yeah. March 31st next week is the deadline to add that. Right. It would be effective July 1st, but there is that penalty. I know we talked about it, but not much on Tuesday. So for every 12 months that you should have been enrolled in Part B and weren't, is a 10% penalty.
Right.
Thank you. Next up, I'm 64, married. My spouse is 52, and he's not a Christian Scientist. We're both on his company medical insurance, which is an HMO, because that's the best coverage for him. What should I be considering with regard to Medicare Part A, Part B, supplemental plans, and for long-term care or long-term care? I really want to put my head back under the sand, but I listened to your presentation and now I can't ignore this anymore.
In that example, that's an awesome example for someone to give us a call, because a lot of it depends on what you're paying for the group plan that you're on. Mm-hmm. What benefits does it cover? Does it cover Christian Science at all? So that's where we would really want to have a conversation, because that's a really specific example.
Right. I was talking to a large company today. Actually, it's a casino, quite honestly, that called in about Medicare and the same thing. And there was a pretty similar example. She can stay on that plan as long as there's more than 20 employees. That's the key with Medicare, more than 20 employees. She can stay on that plan as long as he's still on that group plan. She doesn't have to enroll for any part of Medicare until, right, if she starts to turn Social Security on after age 65, she would have to have Part A of Medicare. But for her, she can put her head back in the sand as long as that company's got more than 20 employees. And she doesn't have to worry about enrolling for Medicare at 65.
Mm-hmm.
I think that was great. Question, right?
Yes, and isn't this great in terms of it's having a plan? I remember talking with people and then saying, "Well, should I get it? Shouldn't I get it?" And in praying about it, how do you answer these questions? In not being a professional like you, but if you're really thinking about something and you need to act on it. Right. It's just because it's coming to you because you should be thinking about it. And so that's, right. I'm glad that this individual is giving it some thought, because if you're thinking about it, take action in terms of, and if you don't take action, know why you didn't.
Right.
But be informed.
Yeah, exactly. Our philosophy is informing you of the choices and the pros and cons. And then we like to call it the sleep factor.
Right.
What is going to help you sleep good at night? What is going to keep you awake? If something's keeping you awake, that's not working.
Right.
So we want to make sure that you're getting the good sleep.
Right. And speaking of planning, John, people spend more time planning their vacation to Hawaii, quite honestly, every year than they do their long-term care, their Medicare, what's going to happen to me. They have a tendency to really put that off. And that's what causes stress, right? If you do the planning in advance, you go, gee, I've got it worked out. I've got my advanced healthcare directive. I've got a course of action, and not rely on, oh boy, it happened to me. Now what do we do?
Mm-hmm.
And it really is too late you want to have these things in place so that you're not scurrying around getting paperwork and something or something if there is a need. It's
Right.
good to be proactive and be thinking about these things. And also, you talk about the sleep factor, but I like what you've said before and then what you said on Tuesday in terms of when it gets to family related issues and who's going to do what and when, how it's going to be paid for, so that when you have 5, 10, or even sooner or later, these conversations at the Thanksgiving table or the Christmas luncheon table or whatever, so that you can be with family and not have these difficult moments which could have been avoided
Right.
by good planning. I like the examples that you gave. If you get a long-term care plan, can you cancel it at any time?
Yes.
Great.
Why would you want to, though? Listen, okay. We sell plans. There's some plans out there that are great. And I tell people, listen, you can purchase this plan, like in California with Nationwide is a great example. I love their plan because after 6 years, in most cases, not all cases, but in most cases, you can get most all of your money back if you decide to cash in. But our advice is, listen, if you're thinking if you're going to do that, maybe you shouldn't purchase the long-term care plan. If your goal is to say, I want to get something, then cash it in. I think it's peace of mind knowing that I can cash it in if I want to. But why would you go through the trouble of paying the insurance company that money for 4 or 5 years and cashing out? In most other states, that's not how it works. You're not going to get all of your monies back. You get some of it back. So I don't know. To me, Katie, what do you think?
I agree.
Yeah.
Next up, I am just now applying for Part B. I am now 85 years old, living independently. How much will I have to pay for penalties for never having Part B? I applied for Part A in 2003 through my husband's Social Security. Since I never had paid employment.
Right. Well, it depends. So they're going to look at when you were first eligible for Medicare. So if I was 65, retired, and I didn't sign up for Part B at that point, that's when that penalty, that clock would start. And like Katie said, for every 12-month period, they're going to charge you 10%. So if it was 10 years, that's 100%. That $170 a month would double. That's pretty easy. But here's the big but, that we've talked to some people that said, well, listen, Jim, I'm 74 and I never signed up for Part B. And I go, well, that's 9 years. But I was working and I was on my group plan until age 72. I go, that's different. Then that would only be a 2-year, right? There's 2 12-month periods, and that would only be a 2-year penalty. So it really depends. Hopefully she may have had, been on some type
coverage
of
through the
coverage.
Spouse, maybe for a few years after
Right.
that.
She can always call Social Security at 800-772-1213. That's 800-772-1213. It's important that you do that because you want to know ahead of time and see if, first off, make sure it's affordable, that you can make sure that's something you want to do, because that's a pretty big penalty.
That is.
Great. If you paid lump sum for a long-term care plan and you cancel, do you get your money back?
We kind of just answered it depends. Some states you can get most or all of it back. Some it's depending on, they call it the cash surrender value in the policy. That's what you'd be entitled to after if you cashed out 2 years, 3 years, 5 years, whatever it's going to be.
So any long-term care insurance plan we were showing someone, we would be able to tell them, here's what you would get back, and here's the timeline for when you would get all your money back, or what portion you would get back.
I really think we hear that a lot. I really think that's peace of mind, knowing, okay, if I don't really like this, I can cash it in and get most or some or all of my money back, right?
Great. I live alone, and my adult son helps manage my finances. He has mentioned long-term care policies before. Would you be willing to speak with him regarding a policy? He's very sharp when it comes to finances. I'm 74 and in very good health.
We think that's an excellent suggestion. A lot of times, and we've talked to actually a few people recently with adult children, especially when there's an adult child that is going to be the one that is going to be providing the care. It's important that they know what you're buying, what it's covering, and how the benefits would be paid out if and when you need the care. So we always welcome family members into the conversation, especially when they're going to be the caregivers. Right.
And that's super important, because we've got talked to a lot of Christian Scientists whose children are out of state, or quite honestly across the other side of the United States. And I said, some of the companies, you get a care coordinator too that will help you. So they can help provide care. This is what you need. They help organize everything. It's a really great service that most of the insurance companies provide.
Great. Next up, my husband and I do not have long-term care coverage and are considering it. You mentioned having assets with the broker. We do have our IRAs and brokerage account with him. Why would he not want us to get long-term care coverage? He has done a very good job with our finances, but has never brought up getting us a long-term care policy. How would we go about finding the cost for these types of policies?
First off, you can shoot us an email or give us a call. And I've dealt, my business partner was a broker for years, and I have lots of relationship with financial planners and brokers. And sometimes I don't understand. We had a great example, and this guy was a banker, John, and a couple of weeks ago, he said, listen, I have X amount set aside for my wife and myself for our long-term care. I said, well, that's a plan. He goes, yeah, my broker, quite honestly, he's got that money. And the broker, remember, they make their money by having your money under management. So if that money leaves their management, they lose money, and they're not in the business to lose money, even though that market goes, I'm talking about the commissions they generate off what you have with them. So I said, listen, why don't you take a portion? Quite honestly, he said, I have $1 million. I mean, that's the actual example. And I know that sounds like a big number, but he's told me we have that set aside, and that's going to be our long-term care. He goes, what can you do? And I said, well, why don't you give us half of that, and we'll put those in 2 long-term care policies. And by the time we ran it out, by the time he was 84 and she was 85 or 85, 84, they each had $1 million of long-term care coverage guaranteed, right? For that $500,000, we had an inflation protection. So I said, by giving us that money, now you can take that other $500,000. And he goes, oh, I could be a little more aggressive or do what I want with it. I go, your long-term care it's contractually guaranteed. You're going to each have $1 million at that age 85 and 86 or whatever it was. Your broker cannot do that. He cannot say, I'm going to guarantee you this money. So a lot of times people want to self-fund. We're like, why don't you look at it? That was the actual example. I wasn't going to say $1 million, but that's actually what it was. We can do it with whatever it is, whatever you're thinking of, I'm going to put in a CD. Take a look at, protecting your family, increasing the payout, and leaving more, quite honestly, to your children and charities. Well, why not? The brokers do not like that because it's taking money, it's moving from their assets under management. That's how they make their living. Exactly. Did that answer, Leslie? You've seen that? If that's
no, right? I think you're absolutely right. That's exactly right. Yeah.
Yep. I guess this follows on. If you don't have children, can you designate anyone as beneficiary if there's money left in your long-term care plan?
Absolutely.
Absolutely.
It could be a family member, a friend, your favorite charity, 501c3, Ardenwood.
Seriously, you're going to leave it to some. Don't leave it to your estate. Have it go to a named beneficiary. Seriously, like John Ardenwood. I know you guys do incredible work down there. Or you can if you can designate 3 or 4 charities, but more is always better, right? Charities need help right now. It's time to really help them. If you can leave more, why not leave more? Don't let it go to your estate where it's going to get, if it goes into.
Yeah, it doesn't have to be left to children. It can be left to a sibling, a neighbor, a friend.
Somebody, do something good. Your church, somebody.
Yep.
Don't let it go into probate. That's what I was trying to say.
Please.
Probate,
That's the headline.
don't do that. The attorneys win.
Have a plan.
Have a plan.
Have a plan.
At one point, you had mentioned AARP and UHC for supplemental coverage. Is there a particular reason why this is a Medicare question. I have a supplemental plan F with Blue Cross. It has gone up several times. Does the AARP UHC plan have rate increases? Do you think that policy would be a better fit for me? I live in the Bay Area and would want to use hardened wood.
Right. So I've been doing this a long time, and I absolutely love the United Healthcare plan because it's endorsed by AARP. AARP only endorses one plan for Medicare, and that is United Healthcare. They have the largest block of business in the United States, over 4.2, 4.5 million people. And John, that's super important, right? Law is a large number with insurance companies. Ensure there's going to be less rate increases. Some of these companies of color, right, that you'd mentioned, they often have a tendency, I've seen companies start off with teaser rates where they're very low in the beginning and they have a tendency to get very high. So we know Plan F from all our Medicare. Plan F is the same with company ABC, XYZ. It doesn't matter. It's the exact same. So some of the plans go really high. What I love about the AARP United Healthcare is they have incredibly low rate increases. Most all plans tick up with age. Theirs are very reasonable, especially over a long period of time. And Katie, I know you deal with this all the time too.
The reason that we really, really like United Healthcare specifically, and any of the companies that we deal with for the same reason, the rates are very stable and good. And the claims payability of the insurance company is amazing.
It's amazing.
We can verify that. They do
Yeah.
pay Ardenwood very promptly without a hassle. So we are we're big fans as well.
Right.
Great.
And then one last thing on that, if you have a Medicare supplement plan, you can change that in the state of California. I'm gonna say that in the state of California, you can change that within 30 days of your birthday. So nothing says happy birthday like shopping your Medicare supplement plan. And you can reach out to us and we can help you and give you quotes for United Healthcare. And so you can see if that makes sense.
Right. And not to keep going on this, but there's many examples I've done with 80-year-olds that are paying I've seen them pay $420, $450 for the same plan that I can move them to with United Healthcare for maybe $282. The exact same plan.
We just saved a client $122 on the supplement that they were on previously, that they had been on for years with another company and another agent. We just moved her and saved her $122 a month. Same plan.
And people get afraid to make changes, right? So a lot of times, if it sounds too good to be true, it is. So normally, like if I was dealing with someone like that, John, I'd say, is your adult daughter or son, is there somebody that we can talk to about it to make sure that they understand we're doing something good, right? If I told you I'm saving your mom $150 a month for the same plan, you're going, I don't think so, right? Something's not right.
Like your dad would have said, you're a
my
huckster.
dad would have said I was a huckster or something for doing that. But people need to know. And it irritates me when these companies don't even help their own policyholders saying, you can move into a new block of business or something, and they allow that to happen. So I'm sorry, that's my pet peeve. Right?
Rant over.
Sorry.
No,
that's my rant.
What we're dealing with. Well, and this kind of leads into that. What your point was a moment ago, this leads right into it. I have an HMO type plan, and I do pay a penalty. I would like to stop the plan. I want to confirm that if I do drop it during the time frame you mentioned, that will no longer have that penalty. Also, when do I apply for the supplemental coverage? I live in Southern California, and if that makes a difference.
So we would want to apply for the supplemental insurance before you drop the HMO plan. We would want to do that application in the next couple business days. And then we would want to have that approval in before the 31st of March. One really, really good thing about United Healthcare is I've seen a lot of times they have either immediate approval or I have approval within one business day as far as their Medicare supplement plans. So they're really, really good at that.
And I think what they meant by the penalty, right? So if they had never signed up for the Part D prescription drug plan and they get that Medicare Advantage plan, it's all wrapped together. You've got the health and the prescription. We've had people go, I'm getting a fine. Why am I getting fined? Well, it's because they never signed up for Part D, the prescription drug plan. And since it's part of that Medicare Advantage plan, that's why they're getting fined. So the answer would be, if you want that to stop, you simply drop that plan right now during this time frame before the 31st, and you go back to original Medicare. You go to A and B without any other coverage. Your D and the penalty would go away. And like Katie said, legally, we always want to tell people you should get this supplement before you drop that plan. But if somebody says, I don't want that plan, I was sold that plan, I just want original Medicare, then the time to drop it's got to be by March 31st.
It's really good to know. We live in New Hampshire. Can Katie and Jim work with us or just give us general information?
Yes.
We are licensed in New
We're
Hampshire.
licensed in New Hampshire.
Great. Next up, you have mentioned leverage, and I'm not sure I quite understand the concept fully. My spouse and I have adequate assets, own 2 homes, and have no debt. We have 2 adult children and grandchildren. Are you suggesting we can use our assets to purchase a long-term care plan? Can you pay monthly or annually? I'm 69 and my spouse is 68. We live comfortably and hope we will never need any type of long-term care. We do not want to be a burden to our children. Is it costly at our age?
Well, it's kind of like that banker example that I just did, that I talked to. Same thing. I've got the assets. Do I want to take some of that and just put it aside in a plan, right, that I know it's going to grow? So I turn whatever, 100 or 200,000 into this large sum of money that I can use for long-term care. The rest of the money now I can focus on for my family, for my retirement, and for my charities, right, to enjoy. So instead of self-insuring, we're saying, just take that, John, have a plan, and let the plan be some type of a guaranteed asset-based care plan where you're going to have those monies. You're not going to have to worry about being a burden to your children because you're going to have the monies that are earmarked for them, right, that they really want earmarked for them without spending on long-term care. I think that's a prudent plan. I really do.
When we're talking about leveraging, what we're saying is a lot of times the premium you put in. So let's say 100,000, just because that's in a round even number, like round even numbers. So let's say you can take that 100,000, and then by the time you need care, it's going to be worth 300,000. You're leveraging your money.
Right.
You're buying this product, and you're letting the insurance company give you more money should you need the long-term care coverage.
That's a better explanation.
Yes.
But you're right. So instead of having to say, gee, now I need $400,000 or $500,000, you've already got that with your insurance plan, right? That the money that instead of spending $500,000 for care, that's already with the insurance company that you've only paid 100 or whatever the example is into that policy.
It's a lot easier to write that, like, $100,000 check than it is to write a $300,000 check,
Right.
over time as you need care.
Yeah.
And then knowing that if you put that premium in and you never use that policy, you're going to get all of that money back or more as a tax-free death benefit to your beneficiaries.
Really win-win.
It really, Leslie, I talked about my son here when we started looking at those plans when they first came out 4 or 5 years ago. And he kept saying the same thing. He goes, what's the loss? I go, well, if you need the assets, right, maybe you need the money. But if not, you've got more for care if you need it. Like John, we said, if you decide, gee, I want to cash out and get some of that, I can. But if I pass away, that money I put in there, if I never use it, it's going to be paid back tax-free to my heirs. So it really is a win-win situation. You just have to decide if that's the best plan for you ultimately, right? That's what you have to decide.
Yeah, it's just having a plan and thinking it through. Absolutely. Are Jim and Katie licensed in Florida?
Yes.
I'm still waiting for someone to get that state that we're not licensed in.
Hawaii, right?
Yeah.
So I'm waiting we haven't got any calls from Christian Scientists in Hawaii.
But that one I'd like to do in person.
So, and it's easy to get licensed in other states, right? We're in quite a few states.
Most, yeah.
But so we're waiting for somebody from Hawaii. Please.
Oh boy. If Medicare Part B is for prescription drugs and I don't take drugs or medication, why would I get Medicare Part B?
I'm sorry, that might be me speaking. So Part B, like boy, is the medical side. So that would be I know for Christian Scientists, most common is if you have a bone and you need a bone set. Leslie knows.
Yeah, so it would be if there was a need for x-rays, setting a bone,
Right.
could cover an ambulance. If you were a sudden need, if you were admitted to a hospital and that was not your plan, but you were there, that is going to be very expensive. So
the emergency room side. Mm-hmm. The prescription side is Part D, like David. So Part B, like boy, is medical. Part D, like David, is prescription drug.
And Medicare supplemental policies will require you to have B as well. You can't just have A and get Medigap
right.
insurance. Even though Part A is the only part that applies in a Christian Science nursing facility.
That's correct.
Correct.
Yes.
That's why it's confusing.
It is confusing.
Next up, healthcare plan noted one who holds a power of attorney or long-term care cannot inherit from trust or estate. Also recently now set up a conservatorship to get paper documents that have a POA.
That would be a Rick Bailey question.
Yeah,
Rick
I'm not
Bailey,
sure. Yeah.
I think his information's on your website, John, for Rick Bailey. That would be a great question. They can email Rick Bailey and he would be able to talk about that. I think that's beyond my pay grade.
Yeah, I've not had a question like that before. So please reach out to Rick Bailey, as was mentioned. He does work with us as well, and Jim and Katie. Are long-term healthcare payments tax deductible? The payments.
Normally, general rule of thumb for the plans we're talking about, no. The old type plans, they were, right? And without getting into too much detail, it really depends if you're a business entity. So it's kind of, some are yes and maybe, and most are no. Right? I hate to be that broad, but that's the way it is.
Yep. Another Medicare question appears. I only have Part A of Medicare and would like to get a supplemental Plan G. I want to make sure I can stay at Ardenwood if I need assistance. I believe you said the plan would cover me for up to a year. I don't believe I will need care that long, but want to make sure I have the correct coverages. Can you please go over adding Part B and the time frame to do that?
So you have until March 31st, 1 week from today, to reach out to Social Security to apply for Part B. You would want to talk to them about what your costs would be, including any penalties, to see if that's affordable. And then once you have Part B in place, that will be effective July 1st. And we could do a supplement that would start July 1st as well. And then Leslie can talk about the length of time.
Right. So we expect quick and whole healing, first of all. So the Medicare benefit, if the need for skilled care continues, can be up to 60 days of full coverage. Additional day 61 to 90 has a daily deductible, and Jim will know right away what that is. I think it's $389.
It is.
That's right.
I have a cheat sheet.
Leslie knows.
And then there is also a lifetime reserve, which is a one-time that you can use, and there still is a deductible for that. So having a Medicare supplemental policy, which requires you to also have B, it will cover those deductibles and it can cover you fully. Many of them will cover you for up to a year. If you do not have Medicare supplemental and do not have Part B, Part A is what it is. So it will play out. If the need continues, you may not have coverage beyond that point. Now, if you used it for a little bit and then left, maybe came back, I don't know, later in the year or the next year, it's a new benefit period if you don't use it for 60 days in
That's right.
between. So it's not a one-time use thing or for the year only once. So it is generous, but it is not designed for long-term care. It is definitely for short-term skilled care. And can I throw out something else? As we talk about long-term care, it just seems like an oxymoron with Christian Science nursing. We expect quick and whole healing. That is how we are wired as Christian Science nurses and Christian scientists. So I think now, as we're talking about these wise provisions for the future, should there be a need, we need to consider that we are handling the beliefs of aging. So whatever that is, when we hear TV ads that suggest symptoms, or we start feeling a little creaky or whatever, that we not starting to justify, well, I must be getting older, or sympathizing with friends or family members that are presented with challenges. We need to be handling those prayerfully, no matter how old you are. So it is in thought. So I think that's just something so important. And for those that are finding the need of care, Christian Science nursing care is certainly proper care that can meet that need. It is a three-part relationship. There's the Christian Science, the patient first, Christian Science practitioner, and the Christian Science nurse. We're all working together to support healing. We are there to witness quick and whole healing, but it does take work and prayer on all parts. So you don't come to a facility to park. You come here to be healed.
That's good. Yeah.
I love it. Thank you, Leslie. I was thinking that, was it Roy Garrett Watson, former wonderful treasurer of the Mother Church, a number of years ago? Someone asked him what his age was. He says, "It's none of my business."
I think that was Paul Stark-Seeley, actually.
Was it Paul Stark-Seeley?
Yeah,
Okay.
but none of my
Okay.
business. Yeah, it's
None of
just
my
a
business.
number, but
Write
it's
that
what
down.
you're,
None of my business.
exactly.
Yeah.
None of my
Let's
business.
keep our eye higher up on things. Now, this is a question, and I'm just gonna, if we could, let's answer this question a different way, because I keep getting, are you listed in this state, that state, this state? Can you say what states you're not listed in? Would that be easier?
Boy. I think we're in about 30, 32 states. Hawaii. We're not in Hawaii, so somebody calls from Hawaii.
Well, maybe I don't want to do you to think,
I remember.
Are you licensed in Connecticut?
Yes. For us to get licensed in other states, since we've been licensed in California forever, it's simply going on to that states. They have reciprocity. So if I'm licensed here in California, I need to get licensed in Alabama. I go on, I apply, I'm approved with Alabama within a day. I'm there appointed, and we can use any product to help anybody in Alabama normally within 3 or 4 days.
And I believe that's one state we're not licensed in.
Is it Alabama?
I believe.
Oh, okay. Alabama.
So it's not like passing a bar exam.
Right. It's really easy. It's quite, so the reason we don't just do all 50 at one time is, why pay for the state of Alabama if we're not doing business in the state of Alabama? That's not prudent business practice. So we just wait. If somebody has a need, boom, we're right there. Mm-hmm. It seems like the big states for us with Christian Science is North Carolina, New Jersey, Ohio,
South Carolina, Missouri,
Pennsylvania,
Illinois.
Oregon, Washington, Illinois, Arizona, Texas seem to be, we got quite a few out of Texas. So
that's helpful to know. So someone could feel wherever they're calling from or listening from, right, they should feel free to just contact you.
Absolutely.
Yeah.
Perfect.
Aloha.
Tell your friends in Hawaii to call Jim and Katie.
This is another Medicare question. I'm 80 years old and live alone in Missouri.
Oh, I thought you were going to say Hawaii.
There you go. I only have Part A of Medicare. I'm worried that I should have signed up for Part B. How do I find out how much the fine would be? I know people are focused on that. We've learned that.
Yeah.
You mentioned 10%, but I'm not sure how many years. Do you think I should have that and the insurance plan G? When would all of this start? It's a bit confusing.
So when we talk to an individual, especially one that could be potentially facing a big fine, a lot of times it makes sense if you're going to pick up B to then really have a conversation. And is there enough need where you want to pick up the Medicare supplement? Can you afford to pick up the Part B with the penalty and the supplement? And so that becomes really a conversation that we have directly with that individual to find out what's going to work best for them. Because to pick up that Part B with
a substantial penalty, right? For 15 years. Yeah, you're 150% of whatever the Part B premium would be added on. Here's what I think, because I think you should call us and we can tell you kind of, look at Part B, like Katie says, having Part B, at least it's a buffer, right? The government, Medicare is going to pay 80%. You're going to pay 20% of a Medicare adjusted bill. That's better than paying 100%. If you can't afford the supplement, that's okay. I think the Part B would be in case of an emergency, right, Leslie? She falls, she breaks a bone, something like that. You don't want to go to an emergency room without any insurance, because I would rather know that I'm going to pay
thousands of dollars.
Right? I'm going to pay 20% at least. So I would say it's important to get the Part B added on and worry about the supplement later, quite honestly.
And that's a conversation that we have with a lot of Christian Scientists, where is Part B, is that affordable? And I've talked to some people where they say with Part B and the penalty, I just can't afford it. Then that's okay. then don't do that. Okay. Don't do something that's going to financially cause you strife. So if picking up Part B is affordable, it's something that you should definitely think about, and then decide on the supplement, yes or no, again, depending on affordability.
And we'll tell you. That's why, like with that in particular, because you're I'm sorry, it was 85, I think, and you have to get the deadline. So we'll tell you. I mean, we'll look at that and tell you right away. Just do Part B and don't worry about supplement. Right? It's more important to get that, I think.
You're muted,
John. You're muted.
Gosh, doesn't look like I am. Can you hear me now?
Yes.
Yep.
Great. Well, that was our last question. So thank you, Jim, Katie, and Leslie, for guiding us through the ins and outs of long-term care, insurance option, and Medicare for Christian Scientists. Please don't hesitate to call any of these three with questions at any time, as they stand ready to help. And I think that's pretty clear from the wonderful conversations we've had over many webinars. And thank you all thank you one and all again for joining us today. We look forward to seeing you on Sunday, May 1st at 2 p.m. Pacific for our online annual meeting featuring inspirational speaker Warren Huff. Please check our website soon to register. So goodbye for now.
Bye, everybody.
Bye.